EPSDT. When the federal lawsuit passed, they were required to maintain that effort, and then the state has picked that up, and then there has been an increased share of cost for growth in that program that counties do pick up a percentage of.
What's the increased share of cost? I don't understand it.
The counties were obligated to pay 10% of any growth that occurred in the EPSDT program after a certain amount. So they're paying part of that already. So they are contributing to some degree for this. So it's not a state-only program.
And how much of it's federal? EPSDT, is there any federal?
It's with the FMAP. It's the enhanced rate right now. It used to be half and half, and now it's the enhanced FMAP. So EPSDT is all federal, and managed care is almost all of that is used as a Medi-Cal match also.
Okay. And it's currently all funded general fund. The current year it's all funded general fund. You're just proposing in the budget year if the voters approved in June.
That's correct.
I mean, in principle, I don't know. All right. Yeah, let's go. There's everybody. Leo, do you have any comments? Nothing. It's the same. I don't know. Go ahead. Yeah.
Madam Chair, we haven't seen the language for this proposal, so we're withholding our recommendation.
Okay. All right.
Madam Chair, Min Sun Park with the Legislative Analyst's Office. We do have some comments about the Proposition 10 proposal.
Oh, okay.
We just
Wait a minute, but they haven't even presented that yet.
Oh,
okay. It's a different universe of people that present on 10, right? From your side? Oh, you're there? Oh, good. Is that you? Yes? Prop 10? No. None of you.
It's different people.
It's all different people. All right. Now, I guess we better just do the public testimony on this and then do the 10. I was trying to get them both together, but I just can't. So, all right, because I got this big lineup. Are you all Prop 63 people? No. Oh, good. Okay. I mean, I'd be in trouble if that was the case. All right. Let's do the Prop 63 public testimony, and then we'll do the 10. Sorry, I confused you by trying to get it together. I realize it's a whole different cast of characters, even on the finance department side. So I'm sorry, you were here, right? Oh, you're the ones. I couldn't figure it out. All right, let's get somebody at the end. So we get them all in order and move ourselves along here. Thank you very much. All right,
Madam Chair and members, I am Pat Ryan with the California Mental Health Directors Association, representing the 58 county mental health directors and 2 city directors. It's really, just listening to the conversation we just had, it's a much more complicated proposal than people might realize. Counties do manage the Medi-Cal mental health program, including EPSDT. They're given money by the state to match, particularly for EPSDT. Counties pay for almost the entire match for adult Medi-Cal right now. So you can't look at the proposal on its own. It is a significant funding source for community mental health, a significant and growing funding source as other funding sources erode, including realignment and the state match for Medi-Cal. So you have to look at the whole picture, and we know for just Prop 63 on its own that because of the economy, I mean, the millionaire's tax is very subject to the ups and downs of the economy. So we know, since we're on a cash basis, that next year and the year after there will be a precipitous drop in Prop 63 funds. Those funds plus realignment funds primarily are the funds that are used to match Medi-Cal for both EPSDT and for Medi-Cal managed care. So there is a direct impact on FFP as well. The entire proposal that the governor proposed, if you include both $452 million a year for 2 years and the federal trigger of $847 million, by our calculation would add up to more than the available funds that are in the cash balance that is supposed to be used to be available for services 2 years from now. So we don't even think there's enough money in the fund in the first place. If the trigger were pulled, it would absolutely decimate the community mental health system in California if that were to happen.
I didn't even notice the trigger question. Somebody, how could you do a trigger on this if the vote was before you pulled the trigger?
It's part of the language.
Never mind. All right.
So voters, my understanding is, and we haven't seen any language either, but my understanding is that the ballot initiative would ask voters to vote for the 2 years of $452 million, plus for the budget year an additional $847 million if we don't get the federal funds that the governor is expecting.
Quite sure how you would get that in an initiative, but okay, I get it. Okay.
And again, these are for non-institutional services. We can't pay for
that's
inpatient
crazy.
care. I want to turn it over to one of our county mental health directors who can make this real and translate
ahead.
this into real local policy.
Thank you.
Chair, members,
Push your little red button.
Pardon?
Push your little red button.
Sorry. My name is Jerry Wingard. I'm the mental health director for Riverside County, and it's a pleasure to be here with you today. We urge you to consider very seriously the consequences of this proposal. The true loss of funding in community mental health will not be $452 million. It would be probably around $700 million because we're using our money to match Medi-Cal. This kind of reduction would absolutely require counties to reduce programs this year and next year. My county has looked at this proposal, and our programs for the seriously mentally ill would be reduced by 75% if we complete this. Second, by reducing the 63 programs, the state and the counties will see higher expenses elsewhere in their budgets. In Riverside County, our 63 program for youth has shown to be effective in avoiding costs elsewhere in the state and the county. This program has decreased youth arrests by 71%, school suspensions by 81%, and school grades have improved by 42%. In L.A. County, in an adult Prop 63 program, they've decreased homelessness by an astounding 80% and decreased hospitalizations by 77%. These are cost-effective, and we would lose them with, or seriously get cut back with this proposal. The increasing numbers in inmates being released to our communities starting this week and about a month ago, many of who need mental health services, is a new demand on our system, which we don't have funds to pay for. The governor's proposal to add the trigger cut of $847 million would dismantle our community mental health system completely. Taken together with the proposals we're talking about, it would be close to a $2 billion cut to our system, as opposed to $1.5. Many people do not know that MISA or Prop 63 and federal funds are really the funds we depend on now for community mental health. They're keeping us intact. Realignment and state general funds for mental health have reduced severely, and the 63 funds are really our only source of funds left for outpatient adult services. In Riverside County, I've had to close several large clinics over the past 2 years. In 9-10, this current year, we cut $14 million out of our budget, and for 10-11 next year, we're already planned out, and we're going to cut $20 million out of our budget. Sweeping all the 63 funds for other uses, even for 1 year, will mean more pressure.
Let me just ask, for myself. Finance, is $847 million more or less than what an annual Prop 63? I don't remember their annual number being that high.
Their annual revenue number, or
Yeah, it used to be about 750 or something, wasn't it?
no, we've seen revenue numbers. We've seen revenue numbers that are higher than that. It,
Yeah, 19
as was mentioned earlier, it has revenue numbers have declined.
Right. So currently,
But we believe
are we
that-
getting as much as $847 million in a given year?
We have.
Oh, not nice.
It's too painful.
appreciate the a copy
Assistance.
of the Prop 63 report.
Yeah.
But basically, we're seeing revenue numbers, and again, we have both accrual and cash numbers, but we're looking at estimated receipts in current year of $1.4 billion and just over $1 billion in budget year.
So that would be pretty much, I mean, basically with your trigger, you're not proposing the 452 on top of the 847. The 452 is embedded in the 847, right?
The 452 is the 847 is on top of the 452.
Well, that is more than the 1 point whatever you just read.
But we're estimating that the end of the 9-10 fiscal year, there will be an estimated fund balance in the Prop 63 fund of $1.7 billion. We believe
Of which
that
counties have mostly submitted plans and given us 5 years and gotten approval to do stuff over 5 or 10 years with that
Right.
money, though.
And those-
So they'd have to stop that.
well, no, there's funding in the 10-11 budget for those plans.
Well, not if you take 1.2 billion.
No, we believe that because we believe that at the end of 10-11, the fund projects a balance of approximately 1.2. So
But
we
not
believe
if
that-
you take 1.2.
Well, we understand that it will. We don't believe it will impact the county plans until fiscal year 11-12.
All right. Well, we'll go back to this later. I mean, obviously, let's take a lot more discussion. I don't want to. We got a lot of people lined up. It is 5:30. I've lost most of my members, so let's just try to get through this.
Well, in short response, we in the counties are actually, I'm required by my board to plan out 3 years.
Yeah, I know.
Because of the reduction in everything. We were reducing every piece of revenue we have. So if it reduces in a year and a half, and I know it, I'm not going to start a new program now and cut it in a year and a half. It just doesn't work.
Senator Huff has a question.
Yeah, I was just wondering, when you finish your testimony, if you could later on or provide us some of the data that you're testifying, and particularly the methodology where you come up with some of the statistics and data that you like dropout rate and, lowering crime. Those things are very helpful.
Yeah.
If you could provide it, that'd be great.
Yeah, how your programs have worked.
We have our own research department that follows all these programs and keeps data.
Good.
And that's
Get
how
it
I
to
got
both
there.
sides.
I just in conclusion for that comment, I want to say that we're planned out through 10-11, and we're using 63 funds to survive in our outpatient programs. We're fully planned for 10-11. We have to be, so it will be a real cut.
Thank you.
Thank you.
Senator Leno.
Thank you, Madam Chair. I'm sorry I missed the beginning of this conversation. I had to step out for a moment, but I just wanted to ask the department, can you remind us, and if this has already been discussed, excuse me, by what margin this failed on the ballot? The first time around. This has been before the voters very recently. What was the margin of loss?
60-40 was my guess, right? Am I right? Somebody out there will testify to this before we're done. Rusty will know to the point.
To the vote. To the vote.
59.
But the reason I bring this up is talk about shaky assumptions. What leads the administration to believe that they can flip a 60-40? And if I can just add to that, I think the governor's popularity is less now than it was when it failed at 60-40. So who's going to be the champion of this?
Senator Leonard, John Doyle, Finance. We believe that this is a necessary proposal. We have a $20 billion general fund gap. If whether the voters approve this or not, we believe it's important to put this issue in front of them, because without that approval, we're going to have to find these funds somewhere else.
You might want to look to putting Prop 49 on the ballot. We haven't tried that one yet.
I mean,
I think we sent a bill down to do that 2 years ago and it got vetoed.
I think the restoration of the vehicle license fee would have a better chance of passing than this. And that's $6 billion.
Yeah. All right. Yeah. But anyway, all right. Where were we? Next up, thank you.
Hi, I'm Doug Stevens from the National Alliance on Mental Illness in Sonoma County, and I'm here to talk about veterans' plight in respect to the mental health issues that we have here. We have approximately 65% of the number of vets are Vietnam-era vets, and these guys are not getting the services that they deserve, either from VA or from the counties. I'm here to ask you, please, not to do anything with these funds. We need them for these vets that are Vietnam guys, plus all the guys coming back from the Middle East wars.
Are some of the counties using their Prop 63 funds for veterans?
Yes.
Okay. That's helpful to know. Some of those counties might want to, somebody in the counties world might want to give us a list of which ones are doing what with their money. I mean, one of the problems with these, no offense, these initiatives, is when that money is just like Prop 10. When it goes directly to the counties, we have no sense really of accountability for the funds. And it's actually a fairly easy target in some ways from up here to say, well, how are you spending? What are you spending that money on? And I think it's problematic for us to even understand. I think Senator Huff's question was right. When you tell us, well, we're doing this with it and it's saving this much at some other level, we don't know that. And because every county, unfortunately, did this differently, it's even more confusing. Because I may know about Riverside programs and think that's what everybody's doing, but Lassen's doing something totally different. So some counties probably aren't using it for veterans, and we ought to know who's who and what's what. So, thank you.
Thank you.
Good afternoon. Kathleen Derby with NAMI, California. As someone diagnosed with a serious mental health condition, who lives well, is raising a family, who put herself through graduate school to become an advocate, and has gainful and meaningful employment, my life is an example of the values and programs of what the Mental Health Services Act can accomplish in our communities. Education that cuts through stigma and leads to effective treatment and acceptance. Inclusive care that is client and family driven and focused on health, wellness, and resiliency. The symptoms and stigma of my condition more than once threatened to eclipse my future. Just as these devastating cuts threaten the future of so many Californians. Your constituents have now voted twice to fund these services, which can make the difference between a lifetime of illness and dependence and achieving true health and independence. NAMI California urges you to respect the voters' decisions and to honor the voices of those who you will not hear from today because illness or stigma gets in their way. Thank you.
I am Molan Malakay with the Sonoma County NAMI. Also, I'm the CEO of the Indian Health Program. And I'm here to talk against the redirect of Prop 63 monies also. We're not from the county, but like Riverside, our county is doing a lot with the mental health money. There's not much resources outside of that coming. And how it affects my program specifically is the Native American population is not that large, but we have about 10,000 people there in that area.
Which county? I'm sorry.
Sonoma County.
Sonoma.
And our people have been traumatized since 1850 when the gold was here and they're trying to kill us off. And they had scalps in our head. They would collect $5 for each of our scalps. And so that trauma has actually brought forth today. We see it today in the actions of our families, and my family specifically also. And so we need help for the services of mental health. If the Prop 63 money were to be diverted, just like the Riverside County, the funds would dry up for us. 2 days of a psychiatrist in our clinic is a lot. It would be without that. And before we had that, I know we had a situation where a fellow needed to come in, but there was no psychiatrist there. So he went home, and he worked over his wife, just an inch of her life, traumatized his whole family. In a neighboring county, a similar situation happened. But that guy killed his wife because he didn't have that kind of service. So it doesn't seem like much to you guys, but it really is important to us, to our people. And so we hope that you would not redirect that money. Don't even.
Well, we wouldn't be doing it. The question before us is.
Don't even put it on the ballot.
The question before us is: are the voters willing to reconsider it again? So, thank you.
Thank you.
Thank you for that perspective. It's helpful to understand who's getting affected by different programs. Ma'am.
Hi, I'm Rosemary Milbrath, and I am from NAMI, Sonoma County as well. I'm the director of the agency there. I also want to introduce you to my son. He is the reason I got involved with NAMI. He is no longer with us.
Earlier, but
Pardon me?
NAMI stands for?
National Alliance on Mental Illness, and we are the local Sonoma County chapter. We're grassroots organizations of family members, people living with mental illness, interested community members, and providers. We have 6 part-time paid employees through Mental Health Services Act, and we have 150 impassioned volunteers who work to put our education, support, and advocacy throughout the community. My son lived 18 years with schizophrenia. His IQ is in the top 2% in the nation. He was a congressional scholar. He traveled Europe. He was an outstanding athlete. He was an incredible, wonderful person, and when he was diagnosed, his doctor said, "That's it. He's done." There were no recovery services. My son died before the MHSA services came forward, but I've stayed involved, determined to work in his memory and have these services for other people who suffer, and I've seen the good effects of them. I've seen young people come into our organization, and maybe they've just gotten out of jail or are coming off the streets, and we provide them with resources and referrals and help. They go back into school, they get jobs, they form relationships, they come back into the mainstream of life. If folks do not get recovery services and are not treated, it's going to cost so much more in the long run, and you're going to see more and more mothers and fathers bringing pictures of the children they've lost. So please don't take the MHSA money. We do so much with it. Don't even try to take it. We take the money that we get through MHSA, and we bring classes and groups throughout our entire county. We go into the schools and educate teachers and counselors on the early warning signs of mental illness. We work directly with the county jail. A lieutenant in the jail is on our board of directors, and we bring recovery services into the mental health units at the jail.
Joe, thank you very much for
care.
Continuing to volunteer. That's always...
I'm Trula Lacalle. I'm the executive director of NAMI California. And all I want to do is to add this. You've heard some eloquent testimony just now. And to keep in mind that these are volunteers. These are people that are giving their time. They're doing self-help. And what they're doing for the California taxpayers, they're stretching dollars, just a little bit of seed money in these counties to leverage community-based organizations that are volunteer organizations like the National Alliance on Mental Illness. It goes a long, long way. Prevention, early intervention has been proven through research to create a much better prognosis in the long term for serious mental illnesses. Thank you.
Hello. Good evening, Madam Chair and Senators. Delphine Brody.
It's dark outside now, huh?
Yes. I'm Delphine Brody. I'm the Mental Health Services Act and Public Policy Coordinator at the California Network of Mental Health Clients. We're a statewide organization serving and representing 1,900 mental health clients of ages 18 and up around the state. We are... We have been involved since the very beginning in making the Mental Health Services Act Proposition 63 happen, and it means so much to us. I echo the concerns expressed by NAMI California and by the mental health directors, and I'd like to add to that the wellness and recovery and resiliency-based services, the client and family-led programs that Prop 63 has made possible mean everything to us, and they do stand between a hopeful future and an abyss for clients around the state. It's absolutely critical that Mental Health Services Act dollars not be rated. And the voters have spoken. We had at least a 60-40 vote against Prop 1E last year, so this would be a big mistake to put this on the ballot. I would also like to say that we have some very promising programs that are just getting off the ground. We have statewide projects to reduce mental health disparities for people of many different cultural backgrounds. We have a stigma and discrimination reduction project that is just getting off the ground, as well as suicide prevention. The Mental Health Services Act is already saving lives and saving so much money. It would cost enormous amounts of money, as you heard from the mental health directors, to have these dollars rated even for a year or two. Thank you.
Thank you. Go ahead.
Madam Chair and committee members, thank you for your attention to this items. I'm grateful for Delphine for asking me to appear with the California Network of Mental Health Clients. My name is Frank Topping. I'm a consumer of mental health services. I'm also a veteran that on his own initiative went ahead and transferred over to veteran services rather than staying on SSI and consuming Medi-Cal services. I was asked this year for the third year to represent older adults on the Mental Health Services Act Steering Committee in Sacramento County, and this year for the first time to pick up the representation of veterans that has been largely ignored. We didn't have a rep before. I'm also on the Interagency Task Force, Sacramento Steps Forward Front Door Committee to go out and meet the homeless in the streets and on the riverbanks wherever we can find them and assess what their issues are, what the needs are. The mentally ill homeless is what I'm concerned with. I was recently reelected for the third term to the as Public Information Secretary of the Sacramento County Mental Health Board, but without their vote I can't speak with them, and I just found out your meeting yesterday. I'd like to speak to Senator Leno's remark about tens of thousands of older adults are going to be affected by the lack of the cuts to mental health services in particular, and they'll just be out in the street. And as Senator Wright alluded to, and I have seen personally, having been homeless with them, you're going to have people dying out there. I've seen personally 8 people that I was close friends with die under the absolute best of care just by accidental deaths here in Sacramento County alone. I was Turning Point's first client in the homeless intervention program and was with probably the first in the state to benefit from AB 34. When the governor cut AB 2034, I was one of the first to transfer over to the Sierra Elder Wellness here in Sacramento County. But once again, I can only reiterate what so many have more eloquently said than I can. But I'd like to make the point perfectly clear. You're going to see more people dying just accidentally on the streets from being homeless and mentally ill. Thank you.
Thank you. I think that program was Senator Steinberg's. That's
Right.
34, right?
Yeah.
The one that got vetoed out of existence a while ago, yeah.
Jolena Vorse with the Urban Counties Caucus. I would disagree with the comments from the California Mental Health Directors Association, the previous counties. I did want to respond to your issue on the election. The special election last year cost county $68.1 million. We have yet to be reimbursed for conducting that election, even though it is in the governor's proposed budget, which we are grateful. I'm not sure what the cost would be if we consolidated it into June. We can certainly check with our elections officials and get back to you, but that is obviously a concern of ours for the additional cost. But specifically on the Prop 63, it would have devastating impacts on counties where we're struggling to provide the critical safety net services that we're required to provide for the state. Thank you.
Thank you.
Madam Chair and members, Ann Arneal P., California Mental Health Planning Council. We oppose the diversion of Proposition 63 funds. This would be a real reduction for persons with serious mental illness who have a substantial need for these services. This would also have a ripple effect through other service systems in the counties and would be very counterproductive. We urge that this proposal not be put on the ballot. Thank you.
Thank you.
Go ahead.
Whichever works. All right.
Hi, Margaret Johnson with Disability Rights California. We agree with many of the previous statements and just want to reiterate that this similar proposal was vetoed by not vetoed, but turned down by the voters last year. And so we're not convinced it's going to go forward, and would just encourage you to look at different ways to bring in revenue into the mental health system. And then just to also just repeat that by cutting the mental health services funds to programs in the community, you're essentially going to put people out on the streets, back into institutions or into prisons and jails. And we just don't want to see that happen, and think that it actually is contrary to the Olmstead decision, which said that it's illegal for a state to institutionalize people who could be served in the community. Thanks much.
Thank you very much.
Madam Chair, Randall Hager. I'm wearing two hats today. I usually represent the California Psychiatric Association, and I am today, but I'm also the newly elected president of the California Coalition for Mental Health. And virtually all the people here today that you hear testifying are members, and there are members who are not absent, and I'm speaking for them. We have taken a position where we're in opposition to the diversion of funds in Prop 63. So the entire coalition is going to be working, should there become a ballot initiative, we'll be working against it like we did last year. And I think I'll leave the point spread to Rusty, who knows more particularly about that. But what I wanted to say, from the viewpoint of psychiatrists, is that, there was about 6 or 8 weeks ago an op-ed in the Sacramento Bee by a resident in psychiatry at UC Davis in the Department of Psychiatry training program there. And he talked about 24 hours in the emergency room. And if you need a story that says and points out and makes clear what the emergency and the meltdown is in counties, he talked about it. I talked to his attending physician, and what that man told me was just horrific. We should not allow this. And what that is, and what will get worse if we do the diversions, is allowing patients who are psychotic, for which there are no outpatient beds, so they end up in the emergency rooms. There are no inpatient beds to put them when we have them in the emergency rooms. Allow them to be, because they are both psychotic but also possibly dangerous, to be put in restraints, to be put on gurneys, and to be on gurneys in hallways for 4 days before there can be a placement for those individuals. And that's in Sacramento County. Sacramento County used to have one of the richest array of services in the state, but like every other county, they've gone through 2 years of huge budget reductions to bring us to that point. So if we go forward with this proposal, that kind of situation is going to be repeated in county after county, and it will only get worse.
But isn't part of the problem with the Prop 63 funds is you can't use them for base services? I mean, that's been one of the frustrations from the beginning of this.
I think that it's fair to say that with
they're being used for community services that may be preventative to preventing that brief. And I don't want to denigrate the services that they are providing, but one of the issues has always been it doesn't fund EPSDT, which is entitlement. It doesn't fund base county mental health services that have been reduced because of VLF revenues falling. It only funds new programs that are not core.
That is essentially correct, and I'll let Rusty address that more. What I would say is that right now, in the current situation, it is the glue that's holding whatever is there together.
All right. Thank you.
Good evening. I'm Susan Rajlal from Los Angeles County Department of Mental Health. And of course, we agree with many of the facts that have been presented here today, but I wanted to give you a little bit more to consider. In Los Angeles County, we serve 67,000 people with the MHSA funding at this point, and our programs have had very good outcomes. We have shown overall an 87% reduction in psychiatric hospital usage for people that are in the MHSA program. We have shown a 48% decrease in incarceration of older adults. That would be adults over age 55. We've shown a 28% decrease in incarceration for adults ages 18 to 55. For this population, we've also seen a 60% reduction in homelessness, and that is for adults, and a 52% reduction in homelessness for older adults. You know, the majority of the MHSA funds are proposed to be redirected for EPSDT, and then some of it for managed care. And as you know, EPSDT serves children. What has happened as we have taken the budget cuts is because of the federal funding that is available for matching for children's programs, we have taken the cuts primarily in the adult system of care. And currently, in the adult system of care, we use MHSA funding to create new and innovative programs that meet the needs of people that are seriously mentally ill, in addition to the ones that we had not served prior. In Los Angeles County, we think that we have served about 40% of the people that have actual mental health needs. If this money is redirected, these people will not disappear. They will be back in the emergency room. And in Los Angeles County, I'm sure you've read in the paper that sometimes all of the emergency rooms are full, and we don't even pick up the people. The sheriff's office does that. They'll be in the emergency room, they'll be in the jail, they'll be on the street. But they won't be well because there's no real health without mental health. You know, for the MHSA program for adults, for instance, for the older adults and the adults that has had such great outcomes, the average cost for adult is about $2,500 per year. If you compare that to the cost of incarceration, which is about $50,000 a year in the county jail, it's just obvious that this program is working and it's making a big difference, and to cut it or to redirect it is going to make a longer-term problem. So we would love to collaborate with you in any way, and we understand the shortfall in the budget. But please take a long-term view of what this program is doing for us.
Because, see, we go back to this problem. Every county does something different. I think this parole program, which this whatever you're doing to keep people out of prison, we like that right now. And I don't know if every county's doing that. Some may be doing it, some aren't. But I think Senator Huff's point with the Riverside is also for you would be helpful if we have whatever it is data you have that shows you who you're serving, what they do, those outcomes that you're talking about. I think the outcome
You'll get that too.
would be helpful and for staff to review and members certainly to see. So, thank you.
Nisette Short with the California Alliance of Child and Family Services. We work with about 100 nonprofit community-based organizations that partner with county mental health departments to provide Mental Health Services Act programs to children and families. Just to echo what Susan was talking about, we know that these children that are receiving these services, if they don't get these MHSA services, we will see them in the foster care system, in the juvenile justice system, in the special education system. So we oppose these, the redirection of the services, and we will also work with our county partners to kind of come up with the list of all the programs and the services and the outcomes, because we think I think everyone will be pretty impressed with what we've been able to do with the money that's available.
You might want to think of a new revenue stream for EPSDT while you're making a list. Okay.
Madam Chair, Supervisor Terry Woodrow, Alpine County, and I'm testifying for CSAC today on Prop 63. So the timing, obviously, as you've heard already, is poor on this. And just as counties are expecting an increase in demand for services, we would have fewer resources with which to provide these services. And in regards to operational problems, it is very disruptive to lay off employees and terminate contracts. It makes it very difficult to rehire staff and restart programs in future years, and especially for a rural county such as Alpine County, those employees may not be there in future years. So this will have long-term implications for our ability to provide the services. Thank you.
Rusty Celix, or did you want Laurel
Well,
first?
why don't you let her?
Go ahead,
Yeah,
Laurel.
that's fine.
Laurel Mildred, Californians for Olmsted. We oppose the diversion of these funds. Just a couple of quick points. I don't want to reiterate what other people have said, but I've worked on the implementation of the Mental Health Services Act for 5 years now, and as you know, the expectation was that this was to provide additional capacity and services when we serve less than 40% of the people. It's difficult to be in the position of having new programs that we haven't explained yet and not fully able to show the outcomes in a way that people are very clear about. But the prospect of 5 years of energy building programs to make an improvement that we would dismantle is absolutely devastating. I also want to say that the realignment tank, the tank of realignment funds that you're aware of, has coincided with the buildup of Mental Health Services Act programs, and the general effect has been that those programs, which are to be recovery-based
and aligned with the best practices that serve people and get the best outcomes are going to be the new programs. And so the effect has been, as the cuts have happened, people have typically transitioned over to the new kind of programs. So when you said that there are those Mental Health Services Act funds are not being used for core services, in fact, they're being used for these transformational, more effective, evidence-based programs. However, despite that offset of changing people over to the new programs, the realignment cuts have resulted in devastating cuts. In Sacramento County, between 4,000 and 6,000 people have lost services. Altogether are being transitioned over. They've lost continuity of service. So as Randall Hager mentioned, people are filling the emergency rooms. They are staying for days in the emergency rooms, and often they're in restraints. It's an inhumane tragedy and crisis that's going on.
Thank you. Rusty Seelix, California Council of Community Mental Health Agencies and Mental Health Association of California. First, the number, 33.5%. That's what the vote was in favor of Prop 1E, 66.5% against it. So it's even worse than 60-40. The context for this is, when we started writing Prop 63, pardon me? Two-thirds. Yes, two-thirds no. Right. Just short of two-thirds, 66.5. 750, when we started, there was roughly $1.5 billion in other funding for community mental health care outside of EPSDT. We estimate about half of that was for community care for adults. That $750 million is all gone. That's because realignment is down, because the cost of the hospitals, which that 1.5 also had to fund, is up. The cost of the EPSDT baseline, which the counties do have to pay out of that, is up. The cost and the revenues are down. So that $750 million of other services, which brought another $500 million of federal funds, is all gone. All that's left to pay for the adult community care programs is MHSA. That's all we have. The roughly $1 billion or so is all there is. And you take that money out of it, then there's nothing. And we reach what is the reverse tipping point. The goal was to get the community programs to grow where the hospital programs would shrink, and then the demand on hospitals would shrink, and we began to reduce out of the cost. We're going the other way. And the studies show that when you stop serving somebody in the community and you wind up at risk of hospitalization, for every 2 hospitalizations they have, which they'll have about 2 a year for psychiatric disability, they're disabled, and they will have 3 hospitalizations for physical health, which, because of Medi-Cal recipients, is a state cost. And that doesn't count the prison cost and the criminal justice system cost and all the other things. There are no savings from cutting this. When you ask about another funding source for EPSDT, the fact is what this program funds, in addition to keeping the adults out of the hospitals, it funds the prevention early intervention programs to get the kids before we would otherwise get them. The reason EPSDT costs so much is because we have a fail-first system. We only get kids in the mental health system after they failed in school, after they're in child welfare, or after they're in juvenile justice. So part of Prop 63 funds prevention early intervention programs to get the kids earlier. We've had, as you know, the Emmy program. That's $800 per kid. It's kindergarten to 3rd grade. Those kids never show up in the system. That's what we wanted to expand, and that's the other programs that the program funds. So there's no, you can't use...
Like you might be able to unite with the Prop 10 folks and fund that stuff together. Oh, good.
We've done that, and we are working together with them, and the programs work together. But the point is, there's no money to be saved. The reason the voters so overwhelmingly turned this down, and the reason they voted for Prop 63 in the first place, is because they see the underfunded mental health system on the streets every day. They see the fact that this has been neglected forever. They see that when we emptied out the state hospitals, we never provided the care that the people needed. And all we're doing is moving them from one institution to another when we don't pay for these programs. There is no savings to be gained from this, and there is no extra money that's out there. We're scrambling to take every dollar that's left to maintain these programs. And by the way, all of the money has to be used for these model programs. You heard a number of speakers refer to the reductions on incarcerations and hospitalizations. You heard the reference to the AB 34. That's what Prop 63 funds. As you know, Senator Steinberg and I wrote Prop 63 with the main purpose to fully fund his AB 34 program. So that model that you all created, in which the governor vetoed, that requires all that accountability, that's all out there, and all 58 counties are spending all the money in accordance with that model. So you heard 2 or 3 of them speak to those outcomes. All 58 could come before you and state the exact same outcomes, because they are all doing the same thing. It's not that they're all doing different things. Yes, there's some slight
They're different
variations.
programs. They may have different accountability, but they're doing different programs. Some are doing veterans, some are doing children's prevention.
They've had to choose with limited dollars as to who to prioritize with limited funds, but all of them are people that meet the same criteria. They all have severe and disabling mental illnesses, and they all are at risk of hospitalization, incarceration, and homelessness if they don't get those services. That's the differences in the programs.
Well, that
but
might
the
be helpful
results
to
are the
just
same.
have, I mean, even if it's a little short, something.
We can provide some summaries for you and all of that.
For all members of the committee.
And give you the
kind of take a
parts
look
that are uniform and the details by county.
Yeah, that might be helpful. And I mean, I'm just trying to get at the prevention thing. The more you can do those prevention things, lower our caseload in EPSDT, then it doesn't create as much hole in the budget if we.
And it not only lowers the
don't do the
EPSDT caseloads, it lowers the child welfare caseloads, it lowers the juvenile justice caseloads, and lowers the special ed caseloads.
I think we need to see those numbers would be helpful.
Right.
Okay.
Okay. Thank you.
Thank you. Okay, is that it on this one? All right, here we go. Last item, 6 o'clock, Prop 10. Sorry, we started late, so actually we'll be done in 5 hours. Okay. All right, similarly, I mean, what's the difference between this one and last year's?
Madam Chair, John Wardlaw, Department of Finance. Essentially, it's the same proposal. It's slightly different dollars. The administration proposes a shift of $550 million to backfill general fund reductions in social services programs and Department of Developmental Services programs. That would be achieved primarily through 2 vehicles. First is a one-time sweep of the state accounts of $308 million. The second portion is a $242 million redirection of the revenues.
Of the county's share or the state share, or whose?
It would be both, actually. It's a total.
Okay.
So this would be proposed for a 5-year period.
How much does it get annually now, more or less? I mean, how much percentage of their revenues are you taking?
We're proposing to redirect 50% of the annual revenues.
It's an estimated 50%.
So for 10,
what
11...
was the proposal last year?
50%.
It was 50% last year, too?
Yes.
Was it also for 5 years?
Yes.
Okay. Do you have the vote figures, or shall I wait for somebody out there to tell me?
I believe it was also, it failed 65 to 35.
They were about the same?
Similar.
Okay. All right. And you're assuming that even though you're attacking their funds again, they'll continue to be good guys and voluntarily give us $100 million this year?
We remain hopeful.
I think the 105, promised would be more sure than your 500 that seems like people don't want to do, but anyway, all right. Anything else, LAO?
Thank you, Madam Chair. Min Sun Park with the Legislative Analyst's Office. We just wanted to know note that Proposition 10 generally funds early childhood development, health, and education programs that are designed to be enhancements to existing core programs for children. So given the state's current fiscal condition, we think it's reasonable to consider a reduction to programs for enhanced services like Proposition 10 before cutting more deeply into core children's programs. Therefore, we are recommending that the legislature adopt the governor's proposal to ask the voters to temporarily redirect a portion of Proposition 10 funds to support general fund-supported state children's programs. Moreover, we just wanted to note that if the legislature wished to go beyond the governor's proposal, we have developed 2 additional options or modifications for you to consider, year, which would perhaps enhance the general fund solution or the magnitude of the general fund solution. The first option relates to the voluntary contributions from the first 5 commissions that you talked about, and that's noted in your agenda. I just wanted to note that in our discussions with finance, our understanding is that the budget is assuming that the $105.6 million would come from the local commissions and not the state commission. So that's sort of what we understand. So we just feel that the local commissions, since they haven't made a funding commitment to Early Start or Healthy Families for 2010-11, we think that rather than relying on this over $100 million as voluntary contributions from the Prop 10 commissions, it might be the legislature may wish to just sweep that amount from the local commissions. That would prevent a budget
Under
program
what
deficit.
legal authority would we do that?
Well, it would require voter approval, so it would be a modification on top of the governor's proposal. So, we note that this option eliminates sort of the budget and program risks for healthy families and Early Start, but it does leave lower reserves for the local commissions to sort of prioritize for their local needs with their temporarily reduced revenues. Our second option is to permanently redirect 50% of Prop 10 revenues to general fund supported programs, and this would be an alternative to the governor's proposed 5-year redirection. Under this approach, we would suggest that the legislature leave the state and local commissions' reserves intact in order to help the commissions transition to a permanently reduced program environment.
Okay.
And again, both of these options would require voter approval like the governor's proposal.
That's the problem. Okay. Anybody else? All right. I got Senator Leno.
Just one question for LAO. So LAO believes that the likelihood of voters changing their 65-35 position on this is more likely to happen than the $6.9 billion coming from the federal government. The reason I ask is that you suggested to us that we shouldn't count on that 6.9, but you are suggesting to us that we could have this happen.
Todd Bland for the LAO. We're obviously not political analysts. I can't tell you how the voters are going to behave. We do think this is worth asking the voters again. There are certainly risks associated with this budget proposal, as there are with many of the other budget proposals before you.
Okay, thank you.
Madam Chair?
Yes.
Madam Chair?
Yes.
Yes. I know everybody's been here for a very long time, and I see the big line. If they could not repeat, and I know their stories are very compelling, but I keep hearing the same repetition over and over. And I know you've been here 5 hours, but so have we.
Yeah. Thank you. Remaking the point we've made earlier. All right. Thank you. Let's move the line in. This is the last round, so poor things. Whoever's first. You want to be first? You get to be over there. It's better for me. I mean, they have been having the first sit in the middle, but it confuses me later. So that's okay. No, it's better. We got it under control this time. You can have one at the podium if you want to. All right.
Well, I'll be very brief. You're getting a handout right now that I'll just comment on quickly. First, let me say that you did note that the vote was 65 no, 35 yes, but I also want to point out that was the third time the voters voted on Prop 10.
You were 65-35. The other one was
65.5
or something. Okay.
I will just point out they actually litigated about the discussion of it on the ballot, and we didn't, so they did a little better, can I say. They got 65.5. I just wanted to point out this is actually the third time that this has been voted on by the voters. They passed it in 1998. They overturned, or they rejected an attempt to overturn it 2 years later when the tobacco industry put it back on the ballot, and then they voted on it yet again in May. So we had hoped the third time would be the charm, and we could just go about the business of doing the work and not have another campaign season. I just wanted to point out a few things related to the handout. There's been a lot of discussion of finding savings, but at equal or greater cost in other areas, and we would assert that that's exactly what the governor has proposed to do here. Of the $1.5 billion that he is proposing to divert to the state general fund, $1.2 billion comes directly from counties. I know it's a little difficult to know what First 5 is doing in all the counties because they look a little different one county to the next, just as Prop 63 does because it's based on local planning. The first 3 pages of this handout are just data from audited numbers to show you in the last fiscal year where money went. And it's kind of high level, but you can get a sense. And particularly the 3rd page where we talk about specific numbers of children who receive specific services. But I'd like to call your attention to the 4th page. This is actually, it's preliminary because we only have about 70% of the current data, but this is looking at contracts currently in place right now at the county level. And what you can see, this is showing the money that is going to public agencies that have been hurt by budget cuts and kind of a continual contraction, and that are serving families that are hurt by the recession. Approximately 30% of it goes to public health, human services, other public agencies, and hospitals and clinics. Those are dollars that are drawing down, by and large, Title 19 dollars and EPST dollars, and they're drawing a lot of money into our counties that have no impact on the general fund. It's money for counties to provide services with no cost to the state. So I think that's really important. This is preliminary because we're just gathering this data, and we'll be very happy to provide more as we get more of it. The 2 things that aren't captured on here are the amount of federal stimulus funds, ARA funds that have been brought in because of First 5 funding, providing the match and providing the technical assistance in the applications, and contracts currently in development. We are expanding a lot of services, particularly around maternal child health, where prenatal services and home visiting have been cut back at the state level. First 5 offers similar services, and we're seeing expansion in those, and that's also not captured here. So what I think this really demonstrates, and you'll hear a few people, and unfortunately, well, actually, probably fortunately for you, a lot of our parents and providers have had to leave. But I think what you'll see is that this really is a matter of taking from children in one budget in order to give to children in another budget, and unfortunately, sometimes they're the very same children. Thank you.
That is our dilemma, is how do we keep them on the core Healthy Families program? Anyway.
Madam Chair, I'm Joel Cohen with the Dental Health Foundation. We're a voice for those who need and seek oral health in the state. And I stand in front of you to ask that you preserve Prop 10 funding. Currently, Prop 10 commissions, especially on the county level, truly are the only funding sources for oral health services for kids.
Since we did.
In the past 3 years, they have contributed over $100 million to education and services for 0 to 5-year-olds. I know through our dear friend Senator Leno that he knows all too well the consequences of children who do not have good dental. And as you pointed out before, Madam Chair, that if we don't consider prevention our #1 goal, then we really are sunk in terms of our system. What we've learned, and I'll be very brief, is that by providing services prior to kids actually ever reaching school, we can, make sure kids reduce their absenteeism and that they can provide a healthier lifestyle. And some very basic things, I know Senator Leno knows this too well, so I won't get right down to it, but I just have to say, that Prop 10 is important, and they do provide really core services for our kids. Thanks.
Thank you.
Good afternoon, Madam Chair and committee. First of all, I'm a parent and provider, and I'm very happy to be sitting here for all these hours, and this is my first...
Sorry,
No, this is my first opportunity to ever speak in front of a committee.
Well,
so
welcome.
I appreciate the opportunity. Thank you.
You have the rest of the year. We have lots of these.
My name is Karen.
If we didn't scare you off this time, we have other opportunities.
You didn't, and thank you. I look forward to those. My name is Karen O'Bannon. I'm from Stanislaus County, the little town of Oakdale, and which is east of Modesto. And about 15 years ago, I attended my first meeting, and when everyone introduced themselves, they all had titles, and they were this and that and whatever, and it came to be my opportunity to introduce myself, and I said, I'm Karen O'Bannon, and I'm just a mom. And what I did find out was that the group of people really wanted to hear from the parents. And so with that, I continued with what we call now the Family Support Network. It's a family resource center that's part of Oak Valley Hospital, a small community hospital in Oakdale, 31 one-bed hospital. And when Prop 10 funding first came to our county, we had the opportunity to apply for $5,000 grants. I wrote 9 of those grants, and we got 8 of them. And so Prop 10 really provided us with the seed money to start a family resource center, and that being so important for the Oakdale community, it's a 40-minute drive into Modesto where those county services were provided. And if you have 2 young children and no car, it might as well be 400 miles away. In Stanislaus County, and I hear this how, again, with Prop 63 and Prop 10, how the services are different in each county. This is a situation where different is really good because we provide services. Our communities are so diverse. Some towns have resource centers where 4 different languages are spoken, but our commission, the Stanislaus County Children and Families Commission, and our executive director have the vision and the wisdom to see that each community can best design what their community needs. And so for that, I really appreciate that. We have 12 family resource centers in Oakdale, and with the we have a staff of 10 right now, and all of our 10 staff members, including myself, started as volunteers or program participants. One of the success stories we have was a high school senior who called us to get some information on child care. She had had a baby, but yet she was determined to graduate from high school. With some funding that we had received from another grant, which is part of the beauty of Prop 10, as I say, Prop 10 First 5 funds helps us to leverage to get other funding. But with that, we were able to help her find a low-cost infant care provider. She went on to be the first person in her family to graduate from high school. She has now graduated from college. I carry a photocopy of her college diploma in my day planner to this day. She's married, a homeowner, and a mom of 3. And it was, I still get chills when I say it, and it cost us less than $200 a month for 4 months to make that happen. As I say, she credits us, but I said, we just opened the door, you took the steps in, and you made it work. The Prop 10 provides those safety net funds to each one of the resource centers, and again, because we have that flexibility that our commission allows us to design what we need to do. We have to work within the guidelines, but we are able to do it how best feeds our community. That being said, we were able to feed 400 families last month, with more than 150 children under the age of 5. In Oakdale, we have a food bank that's open on Tuesday mornings from 8 to 11:30, and that's it. If you miss that day, you have to wait another week. We're that safety net. In Oakdale, we're the one-stop shop. You can get car seats from us. You can apply for Healthy Families. We are the link to other resources. If we're not able to provide them, we find them for them, and we even provide bus tickets. So it frightens me when I hear that funds from our county reserve and from the state reserve could be used for other things when it's been made clear by the voters and by the needs of the families that those funds are to be used for what we do. Thank you.
Yeah, we're just trying to keep those same kids on Healthy Families and give them child care, which the governor's also cutting in this.
Absolutely, we do Healthy Families. In fact,
no, but child care, I mean, is in danger, and Healthy Families and all those same families you're serving are also CalWORKs recipients, and the governor's proposed to get rid of all of those things. So if Prop 10 is the only one left standing, you really have a problem because everybody will be coming to you. So.
Well, that's why we're working to get other grants and have been successful in doing that. But Prop 10 is a big part of what we do. Thank you.
Thank you.
Hi, I'm Sue Greenwald, Director of Early Intervention Services at Children's Hospital and Research Center in Oakland. And I just want to say I just am so grateful for all of your attention all afternoon, hearing all of these devastating proposals. I just can't imagine how you do this. I'm throwing out all my notes so I can be brief.
There's a special mental health program, Prop 63, for legislators.
You need it, right? Exactly.
It's enough money.
And you say you do this all the time, too. Anyway, I wanted to dispel the myth that First 5 funds are enhancements for core programs, because First 5 funds are core programs. And I want to just read you a very brief story. Gabriel was born 4 months
early, weighing less than 1 pound. He was hospitalized for 3.5 months. Upon discharge, he and his family received a home visit from our program, and our social worker found a depressed mother with suicidal ideation and thoughts of harming her baby. Our home visitor was able to get this baby placed in temporary foster care, get this mother the treatment she needed so she could stabilize and reunite with her baby. Without this home visiting program supported by First Five Alameda County and federal fiscal leveraging, this likely would have been another infant mortality statistic for Alameda County. Now, DDS and social services provide really important services, but they're different services. We're providing prevention services to keep children out of those systems, to decrease the costs later on. All the research on early intervention shows that for every dollar invested, you save $3 to $17 in special education, juvenile justice, and mental health services. So we just cannot be short-sighted on the backs of young children anymore in this state. It's just going to cost those children, when they grow up and become taxpayers, an enormous amount of money. So please do whatever you can to not pit social services and DDS against First Five funds. They're complementary. They are all just as important as each other, and these children cannot live without any of them. Thank you.
Thank you.
Good evening. I'm Carol.
Push your little red button there. There you go.
There. Does that work? Okay. I'm Carol Singer. I'm the Clinical Director of Jewish Family and Children's Services of the East Bay. And I'm here to speak on behalf of our youngest children in Oakland, California, because they don't have a voice of their own. And First Five provides many funding for many of our programs. And for the sake of brevity, I'm going to just focus on one. And I will be very brief. But one of the things that it funds us for...
Welcome to do as we suggested earlier to others, too, and submit some of these in writing. I know some of you have and some of you haven't, but, 1 or 2 page letters that lay out some of the stories that you may have or whatever from clients is fine, and we get them to all members of the committee, not just...
Okay, I'll write the more extensive story, but but basically we provide mental health consultation in preschools, and you might ask why mental health to preschoolers, and what people don't realize is that the expulsion rate for preschoolers is 3 times that of K through 12 in California. And one of the things that we're able to do is to help some of these children who are aggressive. The teachers want to kick them out. They don't know how to deal with their behaviors. They don't understand their behaviors. And we can help them and many of the children in the classroom so that these children can stay in the program. Their parents, mothers can continue to work, and they don't start this whole trajectory of school failure from the age of 3, 4, and 5. And I worked in day treatment with severely emotionally disturbed kids for 13 years, and honestly, most of them started out that way in needing much more intensive mental health services, residential services, juvenile hall, which is much more costly because people did not understand how to come up with effective strategies to help them stay in the classroom.
That is interesting. Go ahead.
Yeah. And so we're able to leverage it. It really comes down to a few dollars a day to reach. When you're reaching so many kids in the classroom at once, you're helping teachers gain skills that they'll be able to use with further kids, and we're able to leverage EPSDT dollars for the kids who are identified that need much more intensive service. But we can prevent them from needing that intensive service by being in the classroom and helping the teachers. And the last thing I want to say, which other people have said, is that it's so much more costly to dismantle services and then try to recreate them. Thank you.
Thank you.
Good evening. I am Deborah Armstrong. I'm wearing 3 hats, actually, as I stand here before you. One is to represent First Five San Mateo County. Secondly, to represent the 500,000 children under the age of 5 throughout the state. And third, to represent my twin grandsons that'll be 2 in March. I'm standing here before you to ask that you help us to continue to step up and step out for the 500,000 children throughout the state of California. And you've been hearing from colleagues about what we do, Prop 10 and First 5, I would like to just emphasize 3 things about why. Why First 5? Those 3 things are ROI, return on investment, systems improvement, and government in a unique way. First 5 invests a lot in prevention and early intervention, as you already know. And James Heckman, a distinguished economist and Nobel laureate from the University of Chicago, states that for every $1, we have a return on investment of up to $17. That equates to $9 billion in what First 5 has received this past year. Heckman is among the 10 most influential economists in the world, and that is another reason why First 5 puts so much emphasis into prevention and early intervention services. The second is systems improvement. We've been talking earlier about the right hand not knowing what the left hand's doing. First 5 is a neutral body that works across the lines, works with the Department of Health, social services, education, business, foundations. In the Bay Area alone, we're working with the business community. For example, the Bay Area Council and the Silicon Valley Leadership Group. We are promoting an integrated system of care for young children. Third, we're a government in a unique way. I heard earlier about it is difficult that we are individual, the 58 counties, and have that local autonomy, and it's hard to tell our story from a statewide basis. We're working hard on that, and we're working closely with the First 5 Association to help us do that even better in the future. So we're promoting accountability, reliability, and predictability. And again, I ask that you help us to continue to do this great work.
Thank you. Okay, back to this end. Ma'am, yeah.
Okay. Supervisor Terry Woodrow, Alpine County, and I'm also a member of the Alpine County First 5 Commission. So a takeaway of these dollars to our local commissions would severely impact Alpine County with our rural economy. And the programs that we provide today would have to dramatically be reconfigured or eliminated. The economic development impacts are huge, and our local small population bases do not have alternative programs to redirect our child care needs to. So I urge you to reject the governor's proposal.
Thank you.
Thank you.
I want to make sure your own senators and assemblymen are aware.
Hello, my name's Craig King. I'm the president CEO of Easter Seals Northern California, and we're about half of our budget comes from DDS, but I am here to speak in opposition to the governor's proposal to redirect $200 million plus of First 5 money to DDS. And the fundamental issue there is that it would result not in a wash or an increase in services to kids with special needs, but a significant net reduction in services. To illustrate, I'd like to talk a little bit about what our organization does with our First 5 money in Marin County. Working collaboratively with a number of community organizations and First 5 Marin, we've developed a very successful developmental screening and special needs program in partnership with community clinics, private physicians, local preschools, school readiness programs, and over 20 community-based organizations. The program is aimed at universal screening of all young children looking for developmental delays, disabilities, and social-emotional issues that may impact the child's health, well-being, or ability to participate and succeed in school. As many of our colleagues have already spoken so eloquently toward, early intervention is a very important investment for saving social costs over the long run. In Marin County, over the past 7 years, we have screened approximately 6,900 children. Similar to epidemiological studies, in general, about a quarter of them, or 1,700 children, were found to have moderate to significant developmental weaknesses, and about 40% of these children with delays were found having significant disabilities. The majority of these 1,700 children who were identified with delays do not qualify for mandated services, but they are being served by First 5 funded developmental services through the consortium that I have described. In addition to those 1,700 children, 500 were screened for vision and hearing problems. 800 early childhood professionals received specific training and coaching to help these kids with special needs succeed in school. So what I wanted to close with, so as not to be redundant with my peers, we've heard how the public has spoken repeatedly about voicing their support for investment in early childhood programs. On Friday, the president of AT&T California is speaking to the North Bay Leadership Council on key to success in the 21st century. So we're in the middle of the deepest recession that we've had since the Great Depression. And what is his topic? Investment in early childhood programs. So the public gets it, the business community gets it. It's so important.
Maybe AT&T would like to support a little increase in the corporate tax. That would be helpful.
I can't speak to that, but I would endorse that.
Well, you might ask them that next time they offer to support early childhood.
Thank
we could
you
use
for your time
$200
and
million to support healthy families. Go ahead.
Good evening. Good evening, Madam Chair and Committee. I wasn't going to comment. My name is John Fisher. I'm from Alpine County. I was going to let my colleague do all the commenting, but driving over 2 mountain passes, I figured, I'm here. And actually, Madam Chair, you moved me to comment as you asked what's happening in all counties. So after December, I invite you to come visit us in Alpine. But also, I just want to tell a quick story. As a single father at 18, I entered my child into early childhood program, and this program actually introduced me to community resources, not only getting my child ready for school, but connecting me to these community resources, and actually gave me direction on how to parent and father this child. And I would just like to say, for her sake, a 4.0 in her first semester of high school. So, but also, they also encouraged me to continue my education, and went on to community college and so forth. And actually now I get to direct a program that funds a similar program, a model program in Alpine County. And so my county superintendent couldn't be here today, but she would echo that sentiment as well. The percentage rates of attendance rates have gone up every year. With socioeconomic disadvantaged students, our test scores continue to go up. We provide an interesting comment, which I just want to say, the interesting thing you guys say about it's hard to know what the collective data from all first fives, because everyone is doing something different, which I think is actually a strength. What we need in Alpine County is not what you need in San Diego, but that is a strength.
Yeah.
And so having
It's hard because we get members up here who say, well, I don't like this little thing, or and they don't look at the whole. So the data we got today is what we've been looking for.
Well, interestingly enough, when Senator Cox comes to visit our site, he actually applauds what we're doing in Alpine.
Funny is that he didn't like. It must be Sacramento or something.
But getting to the point of again, just
he's not going to like it after what you just said.
the benefits of just like I said, been immense, and the high socioeconomic disadvantage, and most of them being Native American in our county as well. So just wanted
You have high on that. Be careful if you're driving back home over those passes in the rain and snow or whatever's going on over there. Thank you for coming.
Good evening, Madam Chair, committee members. My name is Sean Casey. I'm the Executive Director of First 5 Contra Costa. I can't add too much to what's already been said, but locally in Contra Costa, our commission last summer pledged to spend $70 million over the next 5 years to ensure that we could provide as much support as possible to families in this extraordinary time in history. To do this, our commission realized that we would need to expend virtually all of our reserves, and they also assumed that our revenues would remain whole. But they also understood that providing high-quality preschool to children most in need, home visiting to high-risk families, and early interventions for children at risk are the best ways to reduce the need for the child welfare pediatric and remedial education services for which state funding is becoming increasingly scarce. Thank you for your attention to this.
Good point. Thank you.
Good evening. My name is Christina.
Wait, let me just ask this one. When you say your child care stuff, Governor's proposing reductions in child care, different days hearing. What, how do those interact? Do you say child care, is that child care for people who earn incomes higher than what we help fund, or?
It comes in a number of different ways. A lot of it is about increasing the professional development of the actual providers, increasing the quality of the services that are being provided, and in our case, we are actually providing funding for people who are on the waiting list but will never be served. And
subsidized care for the alternative placement folks who are on the waiting list?
People who are on the cell, but they earn too much, or they're like the healthy families group in a way. They're just not quite in need enough to actually get the service. But what we're able to do with that is actually raise the tide of quality. By subsidizing those, we are challenging providers to raise the quality of their services. So for every child that we actually subsidize, there's probably a dozen more or so who benefit from increased quality in preschool.
But you're subsidizing folks who are not otherwise eligible, or they might be eligible for our program, but just there's no space for them.
There's no capacity.
So how do you make capacity?
We are working on that as we speak by creating market where we can, by saying we can subsidize slots so that we're subsidizing slightly above the market rate to encourage providers to actually establish more capacity. We don't have enough funds to make this fully scalable.
Yeah, no, I'm just trying to figure out what happens if I cut the child care the way Governor suggested. I mean, it's sort of a...
We can come back next week.
Anyway, all right. That was last week. So, all right. We'll get back to it.
Thank you very much.
Anyway.
I'm Christina Aristudo. I'm Executive Director of First Five Solano, and I just want to thank you for your patience and taking our comments. And since we're on child care, I have another example, but one example of what we do in First Five Solano is we are funding the renovation of a kindergarten wing in a school in Vacaville so that Early Start can come and operate their program with expansion era funds. Another example, we're starting up the first in our county home child care preschool network. We have a disproportionately low number of centers in Solano, so most of our kids that need preschool are actually in licensed family child care or other kinds of child care. And we are going to have a home preschool program for those children. Anyway, you'll hear, I could probably take an hour instead of a minute, I know. But I thought I'd give you
letter is good.
Yeah, I thought I'd give you an example about foster care. In Solano County, First Five funds a program that last year we took referrals on 226 children that were reported to CPS for neglect and abuse, but were not entered into the foster care program. And we did home visiting and intensive services to keep those kids safely in their homes and communities and out of the foster care system. If even 10% of those children had gone into foster care, which is as far out as the child welfare system data goes, they statistically at least 10% will go into foster care in 2 years. That would cost $500,000 a year just for the foster care placement, not the court costs, not the medical costs, not the special ed costs. And we fully fund that child protective services social worker in the social service department because we can't leverage any federal dollars, because in the child welfare system that's considered prevention, and it is not a claimable Title IV-E activity. So we fund that social worker in health and social service. So in many cases, I really appreciated your comment, Senator DeCheney, about how whether it's state, federal, or local taxes, it's still the taxpayer. And in this case, whether it's state, local, or federal funds, it's still the same child that is going to lose services if you take money here, or the governor's proposal, and move it over there. I did want to add that in Solano County for 5 years, we funded the match for EPSTT for all children 0 to 5 that get EPSTT services in our county. This year, we're contributing $300,000 to leverage $2 million in services, and we fund $500,000 program in partnership with Prop 63 for the full spectrum of early developmental health. Thank you.
I'm going to submit that in writing. Some of you might want to share some of these ideas with the governor's office.
Oh, and I want to say it is a real thrill to testify before Senator DeSaulnier. I have 32 years in county government. I'm actually a bureaucrat.
And he used to be your county.
And he used to be my county supervisor.
There you go. All right.
Good evening,
Thank
Madam
you.
Chair and honorable committee members. I am Carol Baker from First 5 LA, and I think it's important to clarify something that was represented by the LAO's office and the governor's office. The $244 million cut is more than 50%. It's 53% just next year, and because our revenues are declining because fewer people are smoking, which is good, each year it ends up being a larger and larger cut. And the same was true with Prop 1D. We estimated that would have been a 57% cut the first year, and then it would have gone to about 68% of our revenue down the road.
Based on a dollar amount, not a percentage amount.
Correct. And I checked with our finance department yesterday, and our revenues are off this year by 7%, which is fairly significant, yes. So, First 5 LA provides direct services to about 160,000 children and pregnant women in LA County annually, and that does not include our early development and screening intervention initiative, which is about 478,000 additional children and families. And First 5 investments in LA County are expected to draw down $50 million in federal funding to the county through the ARA federal stimulus dollars and through the School Readiness Initiative and through MA, the Medical Assistance Administration dollars. We know that members of the state legislature appreciate First 5's efforts to draw down federal dollars, and we were really heartened to see that in the California Race to the Top application that First 5's efforts were touted in that, and in fact it said that First 5 was dedicated to improving the lives of California's young children and families through a comprehensive system of education, health services, child care, and other crucial programs, end quote. And surely now is not the time to compromise this comprehensive system that First 5 has put together. I wanted to speak a little bit about special needs children. First 5 LA has provided funding to about 70 organizations and school districts throughout the county who serve children with special needs and their families, and currently more than 20,000 children in LA County receive those services. Some of the providers of those services were here earlier today, but they had to leave. They are moms as well. One of them is LA Up, which actually provides preschool to 10,000 children from lower income families, and actually that would be below $40,000 annual income in LA County, and the median income in LA County is $43,000 a year.
$3,000 for a family of what?
I'm assuming that it's 4, but I don't know. I can check that for you. Okay. They recently opened a school for autistic children in Pasadena, so that's how they're building capacity. They are actually building preschools, and they are training the workforce as our other initiatives that we are funding. They also have a program in Long Beach that serves homeless children. Para Los Niños, who was also here yesterday, they also serve some of our special needs families, but in total they serve about 9,000 children in 28 different sites in LA and San Bernardino County. And some of these children are children who go to bed on Skid Row every night, and I don't really consider that to be an enhancement program. They are reaching out to those children and serving them because no one else is. So, thank you very much.
Thank you. You might want to submit some of that in writing for Senator Huff and Senator Dutton and some of the others who had to leave early.
Good evening, John Pye, First 5 San Bernardino. As a young Marine, I was taught that we are products of the leaders before us, and we are the leaders for those who come after us. And those are our First 5 families. And we learn the ABCs, which is to increase access, decrease the barriers, and improve the capacity. And that's what we've done. In addition to all the services that you've heard, we also build capacity for our nonprofits, partnering with our school districts and become innovative, such as co-locating services with CBOs, county departments, and schools. Staff sharing, where we do not have enough pediatric specialties, where they are willing to travel throughout the counties just to provide that service, because that service makes the difference for that child, for that family, or maybe even for that county. So for us, we were also able to leverage EPSDT funding. But with that leverage, we were able to come up with an even better idea. Why not leverage Weingart Foundation and some of the other bigger foundations so that we could teach them sustainability, so that we could help them partner and find a good match? And I think this these kind of outcomes are not spoken about, but these are the outcomes that bring additional resources to the counties, to the families, but most importantly, to those who's in need. Now, if we look at the faces in the audience, we represent somebody's brother, somebody's sister, somebody homeless, somebody who's a veteran. So thank you for your time.
Thank you very much. Appreciate you coming and your patience in our 6-hour hearings.
6 hours later, I'll say one sentence. I'm Laurel Klumak. I'm from San Francisco, First Five. I just wanted to say that over the past 10 years, many of us in San Francisco have been building an early intervention system for children that are not eligible for DDS services. I think when the passage of Early Start happened in about 10, 15 years ago, children at risk for developmental delay were not included, and we have tried to build that system with First Five dollars. Thank you. I've submitted my thing in writing.
Thank you very much. Appreciate that.
Good evening. I'm Lindsay Dunkel with First Five Nevada County, and I was going to say I was representing 20 small rural counties, but then my colleague from Alpine.
Since Alpine is here, you're okay.
So I'm representing 19 small rural counties. I just wanted to let you know that in these counties, First $5 are the glue that holds programs and services together, and as you've heard, leverages federal dollars. First $5 extend services to isolated populations in rural areas, and local control of the funds allows rural counties to respond to unique local needs. For instance, in many small counties, young children of parents addicted to meth got services for the first time with local First $5. And as you heard, we partner with many public agencies and create a vital safety net of services to children and families. With the small amount of dollars that rural counties get, we receive tremendous bang for our buck, much more so, I would argue, than a comparable state program would bring. Thank you.
Thank you very much.
And Janice LaRue with First Five Placer. To parry on with what Lindsay had said, Placer has half rural, half urban population, and in isolated areas like Lake Tahoe, 1 in 2 children receive services through First Five, and many of them what you would call core services through our family resource centers, which receive only First Five funding or chiefly First Five funding. Basic needs, health care insurance, sometimes health insurance, because we do fund health insurance for children who aren't eligible for healthy families. Dental care, clothing, parents who find job assistance, who get English as second language, many of those core services for people who don't then use county services. For Placer, First Five funding, people know First Five. It's very well known, and it is very much a local issue. For the $3 million that we get every year, that translates into about $4.5 million and 85 jobs in Placer County, and that's real money. Those are real people and real jobs. And the fact that we serve 10,000 people, 1 in 8 kids in the county, makes it something that's very tangible and in a conservative county. That speaks very clearly, and it's part of the reason why we urge you not to put it on the ballot again for the voters to turn down again.
Defeat it even in Placer County?
Huh?
Did they defeat it even? I don't know the county numbers. Did they defeat it even in Placer and Alpine in those places?
Yeah.
All right. Thank you.
Brandon Tartaglia with Disability Rights California. We support the DDS effort to secure Prop 10 funding by working with the state and local commissions, and we believe it could be done in a way that could suit both their missions. However, the likelihood that the voters would pass such a thing looks slim, and we urge you to look other places to find new revenues to support
both programs.
Yes, thank you.
All right, thank you very much. Is that all the testimony? Good job. Well, I don't know, the rest of you who hung around, but thank you all, staff, too, for hanging around. There will be, the questions we're asking, folks need to go, find these data points and be thinking about some of the alternatives that get discussed at each meeting, because we're on a schedule that requires us to figure out, we're trying to hear everything, but within the next couple weeks, we're going to start trying to figure out what we can do in February that makes sense. So need some help here. Thanks. Bye.